اوكي muscle of mastication عندك اول شيء عندك temporalis muscle. اوكي.
مم.
بعدين عندك masseter. number 3 medial pterygoid. number 4 lateral pterygoid. اوكي. هلا اول شيء التمبوراليس، الماسيتر، اللاترال pterygoid، و medial pterygoid. طيب these are the four names. هلا نرجع التمبوراليس هون الماسيتر. لما بتيجي تحكي you split into two. You have superficial head,
مم.
deep head. اوكي.
يس.
superficial and deep.
يعني اكتب انه we have superficial and deep
Yes.
masseter.
Yes. masseter you have superficial and deep. lateral pterygoid you have superior head and inferior head. والmedial pterygoid you have medial head and lateral head.
Okay, wait. Superior head on lateral
Yes. lateral
and
pterygoid superior head و inferior head. والميديال pterygoid عندها deep head و superficial head.
okay.
اوكي. هلا بدنا نكتب نوتس عنهم انه what are they doing. هلا اهم شيء some general information about muscle of mastication. They are associated with the movements of temporomandibular joint.
This is general for all of them.
Yes, هدول the common thing for all of them is that they are used for the movement of the jaw and specifically movements of temporomandibular joint. Okay.
Mm.
And the temporomandibular joint is the joint between the head of the mandible and the mandibular fossa on the temporal bone. هذا
Okay.
الtemporal joint.
Okay. دقيقة بس. They are associated with movements of the jaw and specifically the temporomandibular joint.
بالضبط. Okay.
Okay.
Now another thing that we have to know, what are they innervated by?
Uh,
They are innervated by the mandibular nerve.
okay. كلهم.
Yes, and the mandibular nerve is the third division of
from the trigeminal.
yes.
Okay.
All right. Now let's go into each one, specifics on each one, and we will see some things that are يعني small so that we don't make memorization very hard. Okay.
Mm.
Origin of this temporalis muscle.
Mm.
Temporal fossa. Temporal
Okay.
fossa is the origin. The,
Yes.
the insertion you can see here, coronoid process
Mm.
of mandible.
Coronoid process of mandible.
Yes, coronoid process of mandible.
نسيت ايه هي فيك تفرجيني اياها؟
أيوه. Let me show you. Coronoid process of mandible is this part. Isolate.
اوكي تذكرتها. خلاص من فوق هي على
أيوه.
اليمين.
Here.
يس.
And so
اوكي.
the muscle, when it goes and we isolate it, you can see that it comes out of the temporal fossa من هون, like this, and then it
Mm.
goes and it sticks to this process called the coronoid process, and you can see it when from this angle.
اوكي.
Okay. And now
Mm.
action, it has two actions. Mainly it helps us to chew. يعني
Mm.
you're chewing food, that's the action. How do you want to how does this chewing word that we usually use in anatomy, what is it what is it broken down into? It's broken down into,
Mastication.
yes,
ولا لا؟
mastication, but we mean elevation of mandible and retraction of mandible.
Okay.
Elevation
Elevation.
and retraction.
Okay.
Okay. A nerve supply.
Mandibular nerve on all.
Yeah, we said mandibular nerve on all. Um,
But
here,
this can be the temporal nerve too from the facial, right?
yes, but where does the temporal nerve come arise from? Let's see. It's good revision for us.
It's important from the facial nerve.
No, trigeminal. You have, I don't know if I can show you here. Um, let me show you. Let me show you very quickly, okay? Let's just put out the information. It says anterior branch of deep temporal nerve and posterior branch of deep temporal nerve. Now, where's when we I will show you exactly where it comes from. Deep temporal nerve. I'll show you the picture. It's from the anterior division of mandibular nerve. Didn't we say originally, we started saying all of these muscles are innervated by the mandibular branch, which is the third branch of the trigeminal nerve. The
Mm.
branch in the mandibular is called the deep temporal. Okay?
Okay.
And the deep temporal, um, how do I say this? Let me show you. Let me show you. You have, just so that we have good revision a little bit on the nerves, you have you have trigeminal, right?
Mm.
Okay. Then we have ophthalmic, maxillary, mandibular. Yes?
Mm.
Then the mandibular splits into two, anterior division and posterior division. And from the anterior, let's say this is the posterior. This is the anterior
Mm.
division. From the anterior division, there is so much that comes out, okay? And one of the branches is called
Lingula.
the deep temporal, and this is what innervates the temporalis muscle.
Okay.
Okay, that's just
Uh,
revision
you
of
know the lingula. Does it come from this branch too?
the lingual nerve.
Yes.
Lingual nerve, yes, it comes from the mandibular branch as well.
Okay.
Okay, because the mandibular nerve, it splits into anterior division and posterior division, and um, the anterior division gives us the most of the muscle innervation, okay, in this region.
Mm.
Posterior division, let me see. I think what you asked about lingual, yeah, you asked me lingual comes out of posterior or anterior, or you asked me lingual comes out of mandibular. What's the question?
Of the anterior posterior. يعني
Yes,
من قدام ولا من ورا؟
yes, I think it's the posterior. Let me just make sure.
I think it's the anterior لأنه the posterior one it's the inferior alveolar nerve, right?
1 second. The lingual nerve comes out of the posterior. I was right. The posterior
Mm.
division, bro, it gives inferior alveolar, it gives lingual, it gives posterior auricular,
Mm.
gives of these. That's the posterior. The anterior, always, the anterior of the mandibular nerve, it has to do with the muscles.
يعني buccinator.
Exactly. Buccinator, masseteric, uh,
Mm.
temporalis, هدول كلهم they're innervated by the anterior division of the mandibular nerve. The posterior division, it takes care of your mandible.
Mm.
It gives off inferior alveolar to go inside the teeth, innervates the teeth, goes to the front of it, splits into, gives the mental or the incisor nerve, uh, and then you have the lingual that goes and innervates part of the uh, tongue, and then also you have the ears, where From the posterior division, there's like a split, and it surrounds some structures, and then it goes innervates the ears.
Mm.
And we will revise this inshallah when we are done with everything. But
Okay.
but just know that now that's the revision for
I
this.
just have a fast question.
Yes.
علمنا شو اسمه فوجنياك انه في شيء exception nerve to mylohyoid. This nerve from which يعني من وين بتجي؟
Nerve
Is it
to
also from the nerve to mylohyoid?
no, nerve to mylohyoid.
Where does it come from?
Yes, I'll tell you now. The nerve to mylohyoid, um, it's a branch of the inferior alveolar, which is yes. So remember I told you there's an inferior alveolar.
Mm,
Inferior alveolar comes from where? For posterior division.
mm,
What does it innervate? The lower deck of teeth, and it ends as incisors, and it ends as mental. So from the inferior alveolar comes out the mylohyoid nerve.
okay,
Okay.
okay.
استنى شوي. Okay. So now next we're going to discuss the next muscle, which is the masseteric. And the masseteric is here, and we're going to select both of them. But first, let's do the superficial because they both um, have maybe different origins, but it's very, very close to each other. Okay. Superficial head of masseteric. Origin, zygomatic bone. Zygomatic bone.
Okay,
Insertion, angle of mandible. You can say angle of mandible. Okay.
okay,
Action, elevation of the mandible.
okay.
Nerve supply, masseteric nerve. Okay, now I told you we did some revision. The masseteric nerve, it's muscles related to mastication. And I told you the muscles in this region, usually it comes from the anterior division of the mandibular division of the trigeminal nerve. Okay, remember this.
Mm,
Okay, and we will revise all of those, don't worry. All right. Deep, again, zygomatic bone. You can also say arch, by the way. Insertion, angle of mandible, same. Action, elevation, nerve supply, masseteric. Both of them are the same.
okay.
Okay, but just know there's two heads. Okay, one of them is superficial, one of them is deeper. That's the difference.
Mm,
Okay, now let's go to we finished two. We finished two. Let's go and do pterygoid, medial pterygoid. Medial pterygoid, as we see, it has also superficial and deep. Okay, superficial and deep heads.
mm,
The origin,
okay.
the origin, it originates from. Wait, let me just see something because I know. Okay, خلاص. طيب, the origin, it originates from the medial surface, the medial surface of the
Mm,
lateral pterygoid plate, of lateral pterygoid plate.
okay,
Okay, the palatine bone as well,
okay.
and it inserts medial surface of the angle of mandible. For example, I will show you so that it's not very confusing. You isolate the mandible. It inserts here, medial surface of angle of mandible. Okay.
Mm.
And action, it protracts and elevate the mandible. It protracts and it elevates the mandible.
طيب.
Okay. And then finally, nerve supply. Medial pterygoid nerve. Again, medial pterygoid nerve, I said, muscles in this region are innervated by the anterior division, right? So medial pterygoid nerve is a nerve that comes out of the anterior division of the mandibular division of the trigeminal nerve. Okay?
Mm.
Medial pterygoid nerve. Okay. And finally, lateral pterygoid. The lateral pterygoid is here, and the lateral pterygoid is made up of superior and inferior heads. Okay?
Yes.
The superior head, greater wing origin.
Okay.
The lateral head, sorry, the inferior head, sorry. The superior head is greater wing. Inferior head, which is this one, it's lateral surface of lateral pterygoid plate. Okay? Lateral surface of lateral pterygoid plate.
Okay.
Insertion, you can see the insertion is to the head of mandible, both of them.
Okay.
Okay? Action, the action,
Okay.
if they contract, if they become short, they pull this forward because they're pulling here. So the mandible will come front. So this is the action is protraction of mandible. Okay.
Okay.
Now nerve supply, lateral pterygoid nerve. The lateral pterygoid nerve, again, I'm telling you again, lateral pterygoid is part of the muscles in this region. So lateral pterygoid nerve comes from the anterior division of the mandibular division of the
بيجمع.
trigeminal nerve. Exactly. That's it. This point done. خلاص.
Okay. Is this issue done?
Yes, it's done. It's what does it say? It says
Suprahyoid.
yes, no. So we have just a little bit more. Now we're done with the first part of it. The
Mm.
second part, suprahyoid, which means they want us to discuss the muscles above the hyoid bone.
الأربعة ما هيك؟
Yes, you have mylohyoid, number one, mylohyoid.
Mhm.
You have geniohyoid,
Okay.
stylohyoid,
Mm.
and then you have digastric, anterior belly and posterior belly. Okay, these four. Mylohyoid, geniohyoid, stylohyoid, digastric.
Okay.
All right, now we reset and we do the same to all of them. Um, always.
الله
First step,
أكبر الله أكبر
first step, you have to mention the names and then you go into the deeper details. So first, mylohyoid. The mylohyoid, remember in your pins, the
Mm.
mylohyoid um, mylohyoid line, where does it exist? It exists in
The
this.
mandible.
And now we know why mylohyoid line exists for the attachment of the mylohyoid muscle. So the origin of mylohyoid is mylohyoid line of mandible. Okay.
Yes.
Insertion, body of hyoid, or just say hyoid bone. You can see hyoid bone.
Okay.
Action, what it does is that it elevates the hyoid bone or depresses the mandible, because if it contracts, it pulls those together.
Okay.
Nerve supply, mylohyoid nerve. Mylohyoid nerve comes from, as we said, the inferior alveolar nerve that comes now from the posterior division,
Yes.
trigeminal nerve. Okay, right. The next one after this, we have geniohyoid. Geniohyoid origin, the mental spine of mandible. Remember, there was mental spines here. And insertion hyoid bone. Okay.
Okay.
Action, same. Depression of mandible, elevation of hyoid. Same.
Okay.
And nerve supply, hypoglossal nerve. Okay.
Okay.
Now, hypoglossal nerve, if you remember, this is cranial nerve number 12. Okay.
Mm.
It has a separate path from everything. Okay. Now, yes, we have stylohyoid. Origin, styloid process, insertion, hyoid bone. Stylohyoid. Origin, styloid process, insertion, hyoid bone. Action, it elevates the hyoid bone.
Elevates the hyoid bone.
Yes.
Okay.
Nerve supply, facial nerve. Facial nerve.
If it's the facial nerve, is it the cervical branch?
Very good. Yes. Yes. I would assume so as well. Let me just make sure.
And I wrote that the facial nerve, that the cervical, innervates the platysma.
1 second. Let's see. Apparently, I was wrong. The stylohyoid receives innervation from stylohyoid branch. There is a separate branch for it. Remember, yes, that's why I'm wrong. Anas, when you talk about cervical branch, buccal branch, zygomatic branch, temporal branch, um, all of those five, or the marginal mandibular branch, these five branches are cutaneous. They innervate muscles
The
that are
skin.
most superficial in the skin, and that's why
Mm.
it's platysma. And so platysma, that's why the platysma, when you say this, look, the platysma is so superficial.
Mm.
Hyoid muscle, look at it, it's deeper. So it needs something deeper. So and by the way, when the facial nerve comes out, there is a nerve that I remembered now that comes out. It's called stylohyoid nerve. And so then it splits into all the cutaneous to innervate the superficial things. Okay?
Okay.
Yes. So let's get it out. Look. So that's the facial nerve. Okay. I'm not sure if we can find it here, but let's try. You can see how it all splits right here. Facial nerve splits and gives off
Mm.
temporal, zygomatic, buccal, marginal mandibular, and then cervical. Okay, no, that's scrotal or clear, but cervical. You get what I mean?
Yes. I wrote that it gives the greater petrosal and the chorda tympani too, but we can't see them on this one, right?
Yes, they because they originate inside the tympanic
Yes,
cavity, in the labyrinth in the canal, facial canal.
yes.
Okay. And this muscle right here, I can't see really the innervation of it, but just know that there's a branch called the stylohyoid branch. Okay.
Okay.
طيب. So now I have a question for you. Wait, did we finish them? No, we didn't finish. We have one more.
We didn't say, yes, we said
Yeah.
action. Okay.
Yes, action is elevating the hyoid.
Elevate. Yes.
But now the last muscle, it's digastric muscle. You have the anterior head or the anterior belly and the posterior belly. Now, the anterior belly comes out of the digastric fossas. Remember, there's digastric fossas on the mandible. Okay.
Mm,
Not this one. Digastric fossas of the mandible. And it inserts into the tendon. This tendon attaches on the hyoid bone. Remember, it doesn't attach to the thing itself, but this tendon, remember? There's a tendon for digastric called the digastric tendon, where the two heads or two bellies attach to this tendon, and then it attaches to hyoid bone. Okay?
okay.
And the action, the action of the anterior belly, it elevates the hyoid bone and it depresses the mandible.
Okay.
Nerve supply, weirdly here, it's mylohyoid nerve. Comes from the inferior alveolar, from the posterior, from the mandibular to the trigeminal. Okay?
Okay. شكرا النيرف.
Mylohyoid.
Okay.
Mylohyoid. Mylohyoid comes from inferior alveolar. Inferior alveolar comes from the posterior division of the mandibular nerve. Mandibular nerve comes from the trigeminal nerve. Okay?
Okay. Mm,
Now, posterior belly, posterior belly originates from mastoid process of temporal,
mm,
inserts into intermediate tendon again, and its action, it elevates the hyoid. Okay? Here, nerve supply is facial nerve.
yes.
Okay.
Where did it insert?
It inserts into the digastric tendon that attaches to the mylohyoid.
Same as the anterior belly.
Yes.
والأكشن.
الأكشن it elevates hyoid bone.
Okay. Facial nerve supply.
Facial nerve supply supplies the posterior belly. Yes.
Okay.
Okay. So remember that the anterior belly and the posterior belly had different innervations. One, the anterior belly is innervated by the trigeminal nerve. The posterior
Mm,
belly is innervated by the facial nerve. Okay.
okay.
Okay. طيب, now, okay, why is your point, the question here is, why is your point discussing muscles of mastication and then muscles of suprahyoid? Why?
I think because the Suprahyoid also are involved in that من تحت
Okay,
for the
so
because it moves the mandible, so it's a part of the mastication, but it's under the mandible. I don't know.
okay, so not really. You have muscle, يعني when you eat, let's say you're eating a burger. Deal?
Mm,
When you're eating a burger, you're using your chewing muscles, muscle of mastication, temporalis, lateral pterygoid, medial pterygoid, and masseter, right?
mm.
Now the food is chewed, and now the next step after the food is chewed, what do we do?
We swallow them.
We swallow them. Now the suprahyoid muscle assists in swallowing
Okay.
because if you swallow and if you can do it, you can do it right now. Try to swallow. You will see that your hyoid bone goes up.
Mm,
And so this up motion of the hyoid bone, which then takes all of the um, You can see also the larynx come up, some structures in your neck, your whole throat comes up. This up motion is mainly because of your suprahyoid muscles pulling on your hyoid bone, assisting in swallowing and giving some space for the food to go down. Okay?
Okay.
So that's how you should memorize. That's the general image. When you start your answer, talk about, hey, this point is talking about muscles of mastication and also muscles that help in and aid in swallowing because we need to chew the food and then swallow it. Chewing the food by muscles of mastication. Swallowing the food is also assisted by elevating the hyoid bone, and the hyoid bone is elevated using muscles that are the suprahyoid muscles. And then you talk about the names for both, and then you talk about the details, like we said. طيب.
Okay.
All right. This point, is it easy?
Yes.